Good evening, everyone. And thanks to Anveshan for organizing these really relevant and contemporary discussions on the variety of ways that COVID-19 pandemic and the associated lockdown is impacting the everyday lives of various kinds of people, cutting across social categories and contexts. I am happy to participate in today's discussion, which has been titled Gender Implications of the Lockdown under COVID-19. So what I intend to do in about 25 minutes that I have is to kind of go through these gendered implications under certain heads of what these implications have been, and speak maybe a little more on the rise of domestic violence that Pranav also mentioned in the introduction. But I'll actually come to that rise of domestic violence as one of my last points, and before that go through other ways through which we see the way in which men, women are affected differently during the pandemic. Some of these gendered implications are more evident and more visible, and I would think that in various ways those conversations are happening. For instance, the direct ways in which the informal sector has been affected, and the fact that women constitute a substantive chunk among this workforce, 90 to 95%, and in the absence of health insurance, paid sick leave or maternity leave, pensions, their lives are made extremely vulnerable. We've been hearing, discussions around it. We've had economists and other social sciences and lawyers, kind of talking about this. And also, in a certain sense, there is the visibility in however much the government of the day wants to invisibilize it, there is still a visibility of the migrant workers and the status of the migrant workers in the country, and how is it that there are gender divides in that. A second issue that I want to raise is that it is important to visualize and address the way women workers in the hospitality sector, in the beauty industry, and in the tourism sector has been affected as a result of the lockdown. And one also probably has to keep in mind that the reopening of these sectors, the hospitality sector, the travel and tourism sector, and definitely the parlor industry, will take much more time than the way in which we are at this moment seeing that some kind of work has will be beginning in the next week, in the next months or so. But primarily because if one has to look at the parlor industry, because all of it is based so much on touch, and given the fact that there is risk in spread, there is the risk of the infection spreading as a result of touch, clearly there is a skewed way in which that industry is going to be affected. Similarly, the dangers of congregation of many people in restaurants or through the hotel industry or through the tourism industry, in the light of the social distancing norms, those will open up much later. So we are actually seeing roughly around, as most reports across the globe seems to suggest, something about from now to about a year or 2 years time for maybe travel and tourism to probably get back to some kind of a way in which it was, and definitely also the hospitality industry, and the ways in which workers there and women workers there are affected, one needs to probably talk about and visualize them. A third issue that I want to raise is that the pandemic has clearly brought out the need for a robust public healthcare system in India. Clearly across the globe, definitely, but if we restrict ourselves in this discussion to India, while a public health movement is significant, it is necessary to highlight the marginality of the ASHA workers and the nurses within the public healthcare system, all of whom have been the backbone and the pillars of support in this health crisis. What has been, I'm not really, comfortable with the war metaphor and the war-related words that is going on to discuss the COVID-19 situation. But in the, for ASHA workers and nurses and doctors, it's the frontline workers that's being talked about. But clearly they are the pillars and the backbone through which, this crisis is being handled. Interestingly, although nursing has been a major profession for women, albeit a very gendered profession, it is ironical that other than a very significant work that has come out from the Center for Women's Development Studies, Srilekha Nayar's extensive study titled Moving with the Times, Gender, Status and Migration of Nurses in India, book published by Routledge in 2012, and a few studies that have come out from the Center for Development Studies in Kerala, and also historically to talk about women and nursing as as education, as profession, through Muthulakshmi Reddy, through Anandibai Joshi. However, we do not really see nurses as a category of women workers being separately and specifically talked about in a collective sense. So they do not really form a category whose vulnerability has been historically and consistently being talked about in women and gender studies spaces in India. What legal and community-based safeguards or entitlements are there for the nurses who work in different categories, right? There's nothing to assume that all of them have permanent jobs in hospitals. So what are these legal entitlements and what are the community safeguards for the nurses who have taken up a triple role during the COVID-19 time, as a triple role of managing patients and giving COVID-19 related responses, because they being one of the first contacts, they are the ones who seem to be debunking myths around COVID-19. They are the ones counseling and conversing with patients and families, and they also have to take care of themselves. So there is as if a triad in which they are, constantly working. And, one probably has to acknowledge and remember that while they take care of themselves, take care of the self, at the cost of sometimes remaining physically separate from their near ones because of the high risk that is involved in their work. And on many occasions, as we have seen being reported in newspapers and televisions, not being allowed to enter their rented apartment complexes for fear of infecting others. It is important to note in this context that the United Nurses Association of Kerala has approached the Supreme Court saying that nurses and healthcare workers are at the front line of COVID-19 and are exposed to hazards that put them at a risk of infection. So for the court to acknowledge what they are going through, and the hazard is not just a hazard with respect, not just a hazard which is a medical hazard, but clearly there is a social hazard that nurses and ASHA workers are also encountering. Similarly, the precarity of the 9 lakh ASHA workers involved in COVID-19 management, and they are told to be acting as the front line of defense in the community during the pandemic, needs to be talked about, specifically and separately. The glaring inadequacies inherent in the ASHA worker schemes which has been in place since 2005 through the National Rural Health Mission, clearly normalizes gender-based occupational segregation and systemic pay inequity. So one definitely seems to begin to feel that from working class movements, from women's movements, and from anti-caste movements, there needs to be demands, again, collectively and consistently made about regularizing the salaries of ASHA workers, better working conditions for them, proper training and safety equipments. These are needed to be done in a sustained manner to as if, recognize ASHA workers as workers and, not depend upon, clearly a charity mode in which, they seem to be taking the burden for a long time and clearly with high risks during this time. A fourth issue that I want to raise is around care work, and one understands that that's actually one area in which a lot of writing seems to be happening, at least in the global context. According to the OECD Development Center report of 2014, men do about 36 minutes of care work, while women spend 6 hours in unpaid care responsibilities in the households in India. So that's a huge study which kind of divides, different parts of the world and has a specific, thing to say about India. Out of that, that number, which is 6 hours, which one understands is also less, clearly less in terms of the data that has been gathered. Out of that, 85% of the time is spent on housework. Now, we have to understand that with the closure of schools, with the closure of childcare centers, there is clearly much more responsibility that women are taking up in the household. Primarily because in any case, care related to children, the elderly, the disabled have always fallen on women within the household. And with all other services, external services closing down, everything is happening inside the home. So clearly, what happens inside the home in terms of work, that actually, clearly increases. And I suppose there is a lot of need to talk. There is a lot of need to talk about work from home, which is the norm, which is in place since the lockdown. But more discussion needs to happen about work at home as well. So clearly there is work from home and work at home that's coming together, and that is increasing the amount of domestic work that is going on during the time of the lockdown. I want to refer to a very recent Lancet article. It's an article which was published on March 14th, 2020, where this article says, experience from past outbreaks show the importance of incorporating a gender analysis into preparedness and response efforts to improve the effectiveness of health interventions and promote gender and health equity goals. And they give an example of the 2014-16 African outbreak of Ebola. The Ebola virus disease, where gendered norms meant that women were more likely to be infected by the virus, given their predominant roles as caregivers within the families and as frontline healthcare workers. Women were less likely than men to have power in decision-making around the outbreak, and their needs were largely unmet. For example, resources for reproductive and sexual health were diverted to the emergency response, contributing to the rise of maternal mortality in a region with one of the highest rates of maternal mortality in the world. So I think the point that I'm trying to make by quoting from this Lancet study, which goes back to talk about the Ebola crisis, is that it is extremely important that in a public health emergency such as this, there needs to be from the very beginning a gendered preparedness about how to handle the crisis, but also what is happening as a result of crisis, both inside the home as well as outside the home. So it's kind of worthwhile to think that how does increased domestic care work impact, let's say, women who are in academic jobs. I think I'm just in a certain sense referring to my own situation and trying to think about it, and clearly it is just not my own situation, and I'll talk about it. Who are in academic jobs with pressures of online teaching, online assessment, right? So if you realize the first social distancing advisory that had come from the government, it clearly said that schools, colleges, universities would be closed and there would be online teaching. Yeah. So where will that happen? That will of course happen inside the home, right? Given that home has actually now become a site of everything. So it's kind of necessary to think, how will productivity be understood? And how will there be any change, any relaxation on, in the academic context, what is known as career advancement schemes for, for faculty members? Will there be any changes that is made during the pandemic or because of the pandemic? Since clearly domestic care work and academic care work has increased. And we've already kind of established that who does it more, yeah? So given that women do it more, domestic care work, and there is also academic work, and there is academic care work, how does that impact, the way in which we understand productivity in academic context? And I think there needs to be some rethinking around that. A recent article in Nature, which came out in April 17, 2020, it's a brilliant article. I would request, most of you to read it. It's called The Pandemic and the Female Academic. That gives us, some kind of an understanding about the complexities that I'm talking about in terms of care work, and how care work has increased, and how does that affect professional work for women. A fifth point that I want to mention is that the pandemic has shown the indispensability as well as the precarity of domestic workers. And again, just like if you think about ASHA workers, if you think about nurses, if you think about, the parlor industry, the domestic workers are also mainly and primarily women. And if these domestic workers are not 24-hour living domestic workers, they have, of course, not been able to come to houses to work. And in many occasions, they were not allowed to enter middle and upper middle class, apartment complexes, residences. And after, at least in Delhi, even after the Delhi government had announced that they can come in, resident welfare associations made their own rules, for which the Delhi government actually had to come out with some kind of a clarification that RWAs cannot make rules over and above the guidelines that has already been given. So we understand. So, I think what I'm trying to suggest is this coexistence of the precarity of them, but also realizing the indispensability of them. So, although the Prime Minister in most of his addresses have referred to this category of workers, appealing to the moral conscience of the employers that, under these situations, you will definitely not give salary to them, even if they are unable to come. Yet, I think it is again time to make a concerted mobilization demanding non-negotiable minimum pay fixation for domestic workers, things like weekly off, annual leave, maternity benefits, which again, constitutes them as a category of workers. And one place where we can draw from is, of course, the 2013 Anti-Sexual Harassment Act, which actually brought in domestic workers within the fold of sexual harassment, where the site of work is actually the home. So, there's something to take from there, where there is a category and there is a legal recognition which has already been in place. I want to finally and quickly go to talk about, in a certain sense, one of the main discussions around the lockdown has been about increased domestic violence. What I'm trying to suggest is that in order for us to understand increased domestic violence, it is important for us to understand the other things that are happening in the domestic space. I think that's the reason why I was talking about care work, I was talking about domestic workers, and then I'm coming to domestic violence within the household. So there's an intrinsic connection as to how has the domestic space got redefined, what has changed in the domestic space, and its interconnection with domestic violence. So, stay home and stay safe, or one wonders whether it is stay unsafe. That seems to be what the spike in domestic violence during the pandemic suggests. The first reporting of this happened on April 3, which said that between March 23 and April 1, the number of complaints that the National Commission for Women received was 257, among which 69 were cases of domestic violence, which was up from 30 between March 2 and March 8, which is a twofold increase. And, I'm sure all of us who are, part of this discussion, we know that whatever figures we get, we know that these are less reported. So, that's true for any situation. And clearly that is more true for a pandemic situation. I think that is something that we need to emphasize, that it is very difficult to report during the times of a lockdown. Further figures suggested that between the beginning of March and April 5th, the NCW received 310 grievances of domestic violence and 885 complaints for other forms of violence against women, many of which are domestic in nature, like dowry debt, bigamy, harassment for dowry, etc., etc. So it's not just domestic violence, it's other things also. The NCW now has a separate category, which is offending the dignity of the woman, and even under that, the number of cases have increased during the lockdown time. So while the NCW figures are revealing, it is also necessary, I think, to acknowledge that specific categories of women are facing specific and different kinds of violence in relation to the domestic sphere, some of which may not even in non-pandemic times be recorded as domestic violence. What do I mean by this? I have three examples. Number one, women living with disabilities. According to a report from the International Disability Alliance, collected from Odisha, Gujarat, and Telangana, Women with Disabilities Network, they suggest, and this is a report that had come out on March 30th, 2020, that there has been an increase in violence from partners and personal attendants that women with disabilities have, as stress levels within the household has increased. There is also no community watch, and women with disabilities choose to keep quiet as they fear abandonment of the family. It's important to remember that there is no disaggregated data of domestic violence that women with disabilities face, which is recorded by the NCW. So that just doesn't exist, but I'm just kind of trying to draw our attention to it. A second, category of people that I would want to mention is sex workers, both women as well as transgender persons in Mumbai, Kolkata, and Madhya Pradesh have not received any assistance from the government and have barely any money to get by, feed their families, and buy medicines. And this is, this is a report that the India Spent had come out, early April. Sex workers living in cramped brothels are also particularly susceptible to COVID-19. The NCW chairperson had actually suggested relocation of sex workers from brothels if necessary to maintain social distancing. It's important for us to remember that their plight is never understood as domestic violence. But, it is still important to talk about because this is, gendered implications of COVID-19. That's the reason why I thought that I should mention it. I would like to end by, just kind of mentioning, I suppose, or rather raising a couple of conceptual points to move to, or to maybe think about what could be policy questions in this current moment as we grapple the gendered implications of COVID-19. Number one, I would definitely think that there is a need to understand sociologically and legally, what does home mean? Home is not a safe space. And that has been established through feminist literature for a long time. Both feminist campaigns as well as feminist legal, studies scholarship. There are certain words that we associate the home with: caged, trapped, confined, control. These have been synonymous with the home. For women with disabilities, for any people exercising choices which go against the heteronormative rules of the home, like, say, choosing one's intimate partner. So in a context like this, in a context like the pandemic, in a public health emergency, which makes us come to the home as if imagining home is the safe space, how do we then talk about the home as we subsequently move forward? So there is a need to, critically engage with the concept of the home as a space of living, but it is also a space of relationships, and, how do we engage with that? A second point, in a pandemic situation, reporting of domestic violence cases need to be made part of essential services. There have been women's organizations which have talked about it now for a while. While there is a WhatsApp number that the NCW has initiated, which is important, but for most women, getting access to a phone and calling for help and reporting violence might itself be a challenge. Because we also know that there is a huge disparity between men and women and having access to smartphones. So can there be other ways of expressing that one is experiencing domestic violence? If we look at the United Nations policy that came out specifically for domestic violence in the pandemic times and is being followed in Spain and France, they're kind of using the medical store or the grocery store or even the neighbor, talking to the neighbor, as testimonies of domestic violence in the difficulty of going to the police station. According to the UN policy brief, designating domestic violence shelters as essential services and increasing resources to them have been proposed by the United Nations. Counseling services through phones and helplines have increased, and in India we've seen Kerala doing it. Very early, the Uttar Pradesh police actually launched a campaign which they called Suppress Corona, Not Your Voice. The Kerala government has been using counseling services and has also initiated WhatsApp numbers. The DCW has talked about the importance of reporting cases. But clearly, in the absence of a national policy to deal with increased domestic violence, it's women's rights organizations, sexuality rights organizations, transgender rights organizations, they are stretching themselves to act as the main support services. And we also have to understand there's a lot that's happening over telephone. And that is something which those who are, again, providing care and counseling services, how is it that their care is understood is something to be talked about. I think I would want to end here by suggesting that it is true that in a country like India, we do have legal facilities in place. We do have the Protection of Women from Domestic Violence Act of 2005, and the Delhi High Court has actually said that PWDVA should be used, in these situations as well. But how do we actually think about the fact that a woman goes out of the house to make this complaint? So I think one of the important gendered lessons I think that we are learning is the difficulty of women to speak out, and how is it that they raise their voice unless there is collective support, unless there is a policy initiative which looks at the gendered implications of specific categories of women workers, as well as understand domestic violence for specific categories differently. Unless, we have some kind of a robust system, both in terms of policy as well as in terms of campaigns, it would be difficult to, to actually transform lives. And clearly the pandemic is definitely transforming our everyday lives. Thank you very much.
Thank you so much, Rukmini. I'd like to invite the next speaker. Garima, over to you. So we'll have the question and answers once Garima's talk is over. Thank you so much. Yes. Garima, you'll have to unmute your audio.
Yeah. Hello.
Yeah, we can hear you now.
Yeah. Good evening, everyone. And I thank Anveshan to invite me to speak on such a relevant topic today. So, Professor Rukmini has in fact dealt in detail regarding certain aspects like informal and formal sector. So I'll start, I'll be concentrating more on the legal aspect. However, I'll cite certain policies also which have, which have been stated, on various platforms. So let me just start that, see, women suffers in a number of ways, and be it as a citizen, as a worker, and in many other forms, as Professor Rukmini has also mentioned. Now, let me first talk about CEDAW. So CEDAW, in fact, in its articles, has clearly emphasized the need, for a basic human right and fundamental freedom to women on basis of equality with men through political, social, economic, and cultural fields. Now, but what we see is that on every front, women suffers from one discrimination or the other. And this is very evident. Article 1 defines what the discrimination is all against. And similarly, I'll mention here Article 11, which outlines the right to work for women as an unalienable right of all human beings. Now, it requires equal pay for equal work, right to social security, paid leave, maternity leave, and many other aspects. But as Professor Rukmini has also mentioned, and I would like to say that yes, in day-to-day life, in courts, what we see is that the women doesn't get the share what she is entitled to. I'll pick up, I'll come straight away to domestic violence, where Professor Rukmini has said work from home and work in home. And that is what we are hearing daily now. And in fact, I'm getting almost, 5 to 8 calls daily asking for some help or the other for the domestic violence. And this is quite frightening because it is not so earlier, but now this has just become a norm. And I always dread, every day I dread, I don't know how many calls I'm going to get for this. And let me put it this way. The care, care in its platform has in fact said that women and children are the most they'll be the most impacted person. And this crisis is not going to limit it to certain aspect, but yes, qua social norms, where a heavy caregiving burden on women and girls in many countries are likely to cause their physical and mental health to suffer and impede their access to education, livelihood sources, and other critical support. It further says that women and girl needs for protection services and includes gender-based violence and intimate partner violence. And it further says that public health emergencies can have a tremendous sustained impact on livelihoods, and this is particularly true for women who are more likely to be engaged in informal low-wage activities or migrant workers. Now, as we see that women suffers on every front, be it as a worker, be it as a citizen. If I say that women workforce is the first one to go in such a crisis or pandemic. Now, as referred to by Professor Rukmini, the ASHA workers case, wherein they have said that they are the frontline women workforce, though they are performing their duties, but the way they have been handled is causing a great concern. The way they have not been given proper gear, the way they have not been given proper food has really caused concern. And there are a number of petitions filed in Supreme Court also, which says that yes, this is what the situation is, and women are more likely to suffer. Apart from that, if we come to in-house work, the important thing which has come up is what is worrying is the domestic violence, the rise in the domestic violence. There is the NCW and DCW figures Professor Rukmini has given, but let me tell you, the Delhi State Legal Services Authority is regularly getting calls for relocating women in distress from one part to another. And this is really a worrisome thing, because there is almost a 200% rise in the domestic violence cases. And let me tell you, this is the most invisible form of violence which we can think of. And this is not just limited to physical violence. It encompasses many other aspects of violence, like sexual violence, economic violence, and number of violence which a woman faces when she stays at, and during this time, the woman has to stay at home. Now, she has to do work from home. She has to perform work from home, and then she has to do all the other household chores, which takes up almost the entire day of her life. And this is taking a great toll on her mental health. I'm not talking of women from a very low marginalized section, but yes, women who are in a better place situation, who are even the from a high middle class families. We are getting reports that they are suffering from mental they have started suffering from mental harassment and whatnot. Because see, we need to understand, domestic violence is not just physical violence. If a man gets a man and a woman, for example, they're staying in a home. Now, a man is also doing work from home and a woman is also doing work from home. It becomes really difficult, when a woman is working, so she's performing her duty as part of the office culture, and then she has to perform the entire household work. So when she has to perform the entire household work, it's a joint family, then it's a bigger problem for her, because everything depends on her. She has to take care of the kids, she has to take care of the elderly also at home, she has to take care of their needs, the entire requirement. And this is what is taking a toll on their mental health. The practical aspect is, yes, we are getting, as a lawyer, I can say that we are getting calls from n number of people asking them to help them out, because it's not just this, but economically also they are suffering, not just the mental health. Let me come to the other aspect of it. It's a financial aspect, because now they have been asked, even if the women is working and have some economic independence, now what is happening is they have to contribute the entire part of their salary component to the household component. So this is what is happening. And a larger concern is, their economic independence is getting it's not, they're losing their economic independence, which is again a worrisome figure. Because what kind of calls we are getting now, distress calls, is regarding this mental and this financial aspect. Now, again, the third aspect which I would like to quote is a sexual exploitation. Now, this is again a very problematic area. Men and women staying together in a home, and now what we have seen is there is an increase. An increase is not to a very ek chota sa percentage, but yes, it's a quite big percentage, and they are being sexually exploited. They have no way to say no, and every time if they say no, the a female partner says no to such a sexual thing, and it's every time that they are beaten up or thrashed, or they have been told to leave the house, even in this pandemic situation. And this is what is a again a worrisome thing, because if we say that a woman has to leave a house at this point of time, then what comes in their mind is, it's better to be thrashed at home rather than to be thrown away. And a difficult aspect is to make them understand that, this is not what you are supposed to take. And another aspect which I would like to say is that now, as a lawyer, if I have to say that we get a call saying that even today also I got a call from a woman saying that she is in distress and her husband has told her to leave the home. So I told her, I give her the required numbers, and I told her to approach the competent authority, and I told her that she need not to worry, because it is not that she has to leave the house. The Domestic Violence Act in fact gives her a right to stay at home, and the other person can be asked to leave the house, the male partner. So many aspects of the domestic violence which obviously women are not aware of, and this is one area which I always feel is not taken care of. There is a Domestic Violence Act. This act was enacted in 2000. This came into force in 2006. However, the provisions and the aspect involved in it are not known by many females in the country. Let me tell you that whenever we get cases, they are not even aware what kind of protection orders they can get, what kind of financial assistance they can get, what kind of medical attention they can get. So these are the various aspects, where the women, they lack knowledge. I mean, they don't know that even they can approach a protection officer, protection officer they're not even aware of. So the protection officer can provide them with medical facility, medical aid. Even if she has been thrashed by a male partner, then she can approach 1, 2, 3, 4, 5, 6 people, and can seek a medical aid. So there is a lack of knowledge, and it's not that they are to be blamed, because the authorities are not. Let me tell you, I'm telling you that the authorities are not doing enough to tell the women that yes, these are their rights and these are available to them, and they can seek they can go to the court and seek these rights. For instance, I have just said that a shelter order or residence order. Now these are the things which needs to be taken care of, and this pandemic has in fact made me realize, as a lawyer I'm saying, that made me realize that we are living in a situation where women are prone to each and every kind of violence. A violence which is so clear and visible, a violence which is not so clear and so invisible that one cannot think of that she might be suffering from these kind of violence. If I have to say, then in Delhi, though DCW and NCW and DCW and National Commission for Women, they are working and they are getting calls, but these are not even the 1/3 of the data of the calls they are receiving. DLSA and the lawyers, they are not taking data from them. What individual lawyers are doing, what DLSA, how many calls DLSA is receiving daily, they don't have that data. So if you take that data in its entirety, so that's an alarming figure, and that's really alarming. I can say so because this is what we are seeing in the courts. I myself is witnessing all these things, and I have never seen that. In 15 years of my practice, I have never seen such kind of panic amongst the women, which they are facing in these stressing times. Now, the household working hours. This is again a problematic aspect. Professor Rukmini mentioned it, household working hours. But I'll put it in a different way. There are no working hours for a woman, especially in these times when she's staying at home. So it's like 24/7, she is putting herself working round the clock and managing the entire thing. There is no way we can say that she has these many working hours and she's working at home, she's working from home this many hours and rest to the house. But yes, it's like 24/7 she is putting her efforts. And I must say there are women who are doing it, keeping it, they are doing it, but yes, they are coming up with all sorts of explanations and validity, seeking validation that whatever they're doing it for their family, for their elderlies and whatnot. But they need to understand that they are stressing too much, they are putting too much workload on themselves, and this will going to take toll on their mental health and their physical health. See, apart from this, if I have to say that domestic violence during this pandemic, there are n ways of dealing with it. However, what I must say here is that the authorities, they have to take upon themselves this challenge to before that, I want to say that there are a number of things, see, before coming to these authorities, the role of the authorities, I want to say that many of the women, they don't know where they have to approach. Even if the numbers are floated, they don't have, almost 60 to 70% women, they don't have a smartphone. So they are not aware what authority they have to, what authority they have to approach in case of domestic violence. And number two, the way of approaching. I can say that even if the women knows that this is the number available to them to approach the authority, still the women doesn't have that much of courage because of n number of factors existing at home. One is the presence of everybody at home. Two, she's not getting enough time for herself to be to be all alone so that she can give a call and request for the help. So one thing is that the authorities have to make clear the numbers. They have to give these numbers. Number two, they have to, as Professor Rukmini have rightly said, that they have to appoint people so that the women can easily approach and can tell their problems. Now, the one thing which is coming, which is acting as a hurdle here, is a woman has a number, women know how to approach, but she doesn't have a courage, or there is some problem. So this middle thing, the problem to approach the right person has to be taken care of. The authorities have to understand this. DLSA, in fact, and various other organizations, they have been approached in this pandemic times to shift women even from one state to another. So they have been providing e-passes, in fact, at times when this is so emergent, to shift a woman from one place to another. And there have been number of cases where a woman was beaten up, thrashed, and literally thrown out of the home, and they have to relocate the women from the matrimonial home to the to her parental home. So this is also has been done and taken care of, but this is not the solution. The solution is to develop a mechanism, to develop a system where where we can assure that women get access to various authorities and the services available under the under the Domestic Violence Act, or the rights available to them. So I would like to end here, and by saying that yes, this is a time, this is a testing time where we need to understand that many things are at stake, and this is a time where we can develop, and we need to understand that we need to have that harmony, and that has to be taken care of. Thank you.